Greetings! I am Gabriela Zambrano, internal medicine specialist with a master in infectious diseases. I would like to share with you the dossier of one of our patients in order to illustrate a case of rare manifestation due to COVID-19. Background on case report. Neurological manifestations of COVID-19 are becoming more common as the pandemic evolves. Polyneuritis cranialis are rare disorder associated with a multiple cranial nerve compromise represents one of such manifestations. We present one of such cases to illustrate the importance of its diagnosis during the pandemic. A 34-year-old female with no relevant medical history was evaluated in outpatient practice complaining of fever, malaise, dry cough, and hemifacial hyperalgesia, blurry vision, and no specific morbidly found rash. Vital signs and physical examination were not relevant during the first consultation. She was prescribed with general analgesic with partial remission of her symptoms until 1 week later when she returned, this time complaining of anosmia and nausea. At this moment, a PCR test for SARS-CoV-2 was reported as positive. General measures and domiciliary isolation were instituted with apparently no complication reported until the patient returned to her follow-up appointment, this time complaining of palpebral ptosis and blurry vision in her left eye, as well as left facial palsy and persistent anosmia. Visual acuity was reported at 20/30 for both eyes, and full ophthalmological examination was conducted reporting the presence of an isolated visual defect located in the upper nasal of the right visual field. Endoscopic evaluation and intraocular pressure were normal. A brain MRI shows no signs of vascular or ischemic anomalies. In view of the results, a short course of steroid regimen was administered with regression of the reported symptoms save of her slight facial paresthesia. I would like to share with you two pictures of our patient. The one on the left shows the facial features of our patient. Notice the presence of a discrete rash as well as hemifacial edema. These findings could be attributed to an early immune response due to the infection of SARS-CoV-2. These clinical features would have been remarkable if not for the next symptoms our patient displayed 1 week after her first visit. The picture on your right displays the visual field test performed to this patient. Notice the presence of an isolated defect located in the upper nasal right visual field. These symptoms was not present during her first visit and suggests the presence of a neurological manifestation in a later phase of the disease. To this date, the exact mechanism that produces such kind of disorders is unknown. However, it's logical to suppose that the same features of immune-mediated injury caused by other coronavirus such as SARS and MERS can be applied to neurological injury due to SARS-CoV-2. Some researchers have confirmed direct neurotropism by SARS-CoV-2, which could explain the symptoms encountered in some patients during early phases of the disease. Yet the most plausible explanation for cases like ours is that of immunological injury due to regulating immune response and the production of antibodies in later stages. The possibility of this manifestation should motivate clinicians to conduct a more detailed examination of COVID-19 patients during the pandemic. Learning points and conclusions. Exploration of cranial nerves in patients with suspected or confirmed COVID-19 yields valuable information to identify neurological manifestation of the disease. Polyneuritis cranialis is a rare but identifiable manifestation of COVID-19 and should be screened more carefully during the pandemic to identify it promptly. Thank you very much.